sorry I didn't hear you come in. To make yourself nice and relaxed. I've just been going through your notes. I do understand how you've injured yourself. You fell into a bush, and I understand this is the second time it's happened this week. Yeah. Okay, not to worry. Just looking around your face, I can see a number of scrapes, bruises and bumps. Although the majority of them do not concern me in the least, I will be taking a look at the various scrapes on your face, just making sure they don't get infected. So I'm just going to be spraying a solution here just to numb the effects of any pain. That will then enable me to have a good prod around there to check there's no foreign objects stuck in your face. Okay, so I'm just going to be covering up your eyes here. So, okay. Yeah, I have sprayed quite a few patients in the eyes, which they don't appreciate. I do try to keep that to a minimum. Alright, we're going to be taking a look. Yeah, first of all, I'm just going to use my hands actually, and then I'll be checking with a light. So I'm going to give that a few more seconds just to kick in. Yeah, I understand it takes a little bit longer. I don't want to cause you any pain if I can help it. Even if it is, the second time you've fallen into a bush this week. Okay. That should be plenty of time now, so okay, we're going to be using my hands first of all. Just having a little prod around. It's not really painful, is it? It's very minor. That's okay. And just making sure there's nothing obvious, at least, in the wounds. Yeah, so let's quick look in the light. It's not a bright light, so don't worry, I won't be causing you any eye injury on top of all the bruises and scrapes that you have. Yeah, actually there's a little bit there. I'm just going to grab my tweezers here and pull out, looks like a fawn. Yeah, okay, let's just get that out of there, because we don't particularly want to be walking around with fawns in our faces. Okay, so it shouldn't hurt, but in a moment I'm going to ask you to take a deep breath in, and then I'll yank that sucker out of there. Alright. Okay, let's make sure I've got this right now, so it's very tricky. Okay, just keep still for me. If you're going to sneeze, please tell me, because I don't want to cause further injury. Not gonna sneeze. Sure. Okay. Keep it nice and still. Even stiller than that. There we go. Okay, then take a deep breath in. 3, 2, 1. There we go. We got it. So there we go. That was one fawn removed from your right cheek. Let's have a look elsewhere. I don't believe there's much in the way of additional fawns in your face. Let's have a look. Something there as well. I think it's just a little bit of a dirt particle. So again, nice and still. We missed a sucker. Let's get it again. No. Come around the side here, so slightly, just going to be attacking from a different angle. There we go, we got it. Yeah, it's just a little bit of dirt. But we'll be giving the wounds a thorough cleaning in just a moment. Just going to be checking for any other foreign particles, fawns, dirt or otherwise. You have a leaf on your face there, if you can believe it. Just get rid of that real quick. There we go, nice and simple. It does appear that you have a full shrubbery on your face. But we got rid of that, so that's fine. Elsewhere, looking as good as one can look with, on account of the fact that you've fallen into 2 bushes this week, so in some senses you're not doing too bad. Could have been a lot worse. It could have been a very, very thorny bush, in which case I'll expect you to be covered in said thorns, along with all manner of wildlife and goodness knows what else. Okay, so yeah, I think that's pretty much it for the various parts of a bush in your face. Yeah, alright, we're going to be cracking on then with the cleaning process. So this will involve me using these wonderful contraptions. I'm sure you've seen these many times before. And we're going to be dousing these in a liquid solution which enables the cleaning process to take hold. So sort of antibacterial sort of cleaning solution there, sort of one size fits all, cure all, and the idea is just to clean out the wounds to avoid any potential infection. Okay. Oh, that's a tough lid to remove. Okay, now we're going to try and not get mess all over my wonderfully clean and organised desk here. There we go. So again, I want you to keep as still as possible while I clean the bigger wounds or scratches and the various little cuts that you have all over your face. Okay, we're not going to be attempting to resolve the sort of bruising and stuff. We want that to sort of go all by itself, but we are interested in minimising any potential infections with the cuts. So we're going to be sacking those cuts for you. The swelling and the bruising. Okay, it's not painful. Swelling and the bruising will go down by itself. If it persists after, say, 72 hours, you can always contact your local GP, but we don't expect that to be the case. But you know, we're always concerned when it comes to cuts and bruises, particularly if you've been into a park. Of course, there is the possibility of dirt and God knows what else, dog feces, etc., that can get into a cut and make it a rather nasty scene. But you know, once you've been treated, everything will be absolutely fine, and I expect you will be done here within about 10 minutes. And I don't expect any complications from any of the cuts or bruises that you have. So you did the right thing coming in. So well done. Apart from having the contents of a bush on your face, I do hope you've been having a reasonable day. It's not every day I get to do something like this actually, so it is somewhat entertaining. Yeah, you did see a different doctor a few days back, didn't you? Yeah, same hospital, isn't it? Yeah, it's a shame. You'd think you'd learn the first time, but you've really not had a good run of luck. Yeah, that's absolutely fine. Things happen. You know, we see people with all manner of injuries. People, you know, have vacuum cleaners attached to themselves. That's quite embarrassing, as you can imagine. Buckets stuck on heads, things like that. Yeah, it's amazing what we see. Okay, so looking good. Just again using the solution. I'm going to put a couple of mini bandages on your face. I would say leave it on for about 48 hours, and you can remove them. I'm probably only going to put a couple on there. A couple of the bigger wounds there and there need some attention. So actually there is one above the eye there that possibly might need a mini bandage. You will leave today looking like, you know, like a plaster or band-aid salesperson, but we want to be safe rather than sorry, so we don't mind sort of leaving patients looking like idiots. Okay, one more. They should do the trick, because I completely miss the cotton bud Q-tip and get it all over my table. Never mind. You're doing well. I know it's not always the most pleasant thing having to come into the hospital, but it is the best place to get seen and treated, so you absolutely did the right thing. Okay, just holding your head here, just to help me apply the solution. Oops, sorry, I might have knocked your nose there. I do apologise. It is a rather big nose though, to be fair. Okay, that's pretty much most of it, I would say. I might give it another going over, see how it is. Okay, I'm going to return to my wonderful notes here. Just writing down what we've done. So we started with the visual inspection. Removed three, I think it was three, there was a bit of dirt, there was a thorn and a leaf. So that's 3 items removed, including a rather sharp thorn, which we can only suspect was part of the bush that he fell into. It would make sense, wouldn't it? Luckily we don't appear to have at least any fecal matter on your face, which is always a bonus. So removed without problems, no inflammation or excessive inflammation noted. Usual sort of minimal redness and swelling, that's fine. Yeah, looks fine. Don't expect anything to get infected or anything like that. Okay. And okay, we're going to be just making sure I've cleaned out the wound sufficiently before applying those mini bandages. Alright. Before I do that, I'm just going to take a look. I might use a brighter light actually, just to make sure I haven't missed anything. The lights in here can be rather dull. So this is my wonderful contraption here, which always gives me trouble to get this on properly. Is that it? No, that's not it. It's tricky one this, so do bear with me. There we go. Alright, so this is usually used for the eyes, but we do like to use, as I just blind myself, we do like to use a variety of instruments which are not, they're kind of handy to have because you can use them for multiple purposes, is what I'm trying to say. And, yeah. Alright, so this is a very bright light, so if you want to pick a spot on the back wall, that's fine. I want to look at my wonderfully straight nose, that's fine as well. Alright, so I'm just going to take a look at various points on the face, just making sure I haven't missed anything that's could be potentially troublesome. Okay. Okay, so no, that's fine. That's absolutely fine. Okay, just looking around the forehead area. Okay, everything seems good. Looking at the right cheek, fine. Left cheek, that's fine. Chin, you've got a couple of minor scrapes on the chin actually. I'm just going to be treating those very quickly. So same again, just using that very same cleaning solution just to disinfect the wound and make sure it doesn't get any worse. So again, just keeping still for me. Really did a number on you, this bush, didn't it? Yeah. So I can see the old scrapes from the first bush incident as well, so yeah, it's quite unfortunate really, isn't it? Alright. There we are. Okay, administered additional solution to the chin area. A few minor scrapes. Okay. taking off my gloves because once I say once, it's happened a few times really, I was putting or attempting to put plasters on people's faces and I ended up just sticking them all to my glove instead. So that wasn't a good look, and I was made to look rather stupid that day. I know it's hard to believe, it doesn't happen very often, but fortunately it does happen. Get the glove off, there we go. It's always a relief to get these off because your hands can sweat. Yes, it's very unpleasant. I'm sure you wanted to know that, but there we go. Get these off. Just throw that over there. That's what we do, we just throw gloves around. It's part and parcel of the job, really. Alright, so bandage time. Now, judging from the size of various cuts and scrapes, okay, I think around the nose, I'm going to use one of these wonderfully shaped bandages. I like to call it the butterfly because it looks like a butterfly, and it's rather pretty. Okay, make sure I don't rip the bandage. There we go. Just pop that down there. Throw that in the bin. There we go. I'm getting really good at this throwing stuff. You know, I mean, I could walk those extra 3 feet and, you know, it'd be in the bin 100% of the time, but, you know, you could do that, or you could be throwing stuff and, you know, I'll get a good 85% bin to no bin ratio, so it's not bad. Okay, so I'm just going to show you the bandage. You can see it's shaped like a butterfly, or an hourglass, or a moth maybe. Bow tie, makes a good bow tie, doesn't it? What do you reckon? Yeah, I should probably stick this on your face now. Apologies. Okay, so this is going to wrap around the bottom portion of your nose. No, not the bottom, yeah, this sort of part. Yeah, that's it. Okay, keep it still. I have to say, that's certainly added a bit of character anyway. Okay, that's great, looks fine, just making sure it's on there properly. Alright, that's fine. Okay, so we have some small ones here. I'm going to use, probably 2 more of these actually. Okay, so I'm going to get the one above your left eye. We're only interested in the sort of thicker cuts. The small ones will close on their own. All it needed was that solution really. I mean, it would have closed on its own anyway, but the solution speeds up that process. So we do expect most of these wounds to close within 48 hours, if not even 12 hours. So, like I said, if any pain persists, or if for whatever reason you're not happy with the results, do contact your local practitioner and he'll sort you out, no doubt. Okay, keep it nice and still. Okay. There we go. Just wrapping that around the side of your forehead there. There we go. That's wonderful. Alright. Yes, I think the next biggest wound is below your right eye, so we'll get one on there and then we'll call it a day. Okay. So you behaved yourself very well here. There's no bushes or anything so you can't fall into, which is always a bonus. But thank you for remaining very still like a statue. It's very appreciated. might get the bin this time. Okay, so again, keeping the head still as possible. Okay, here we go. There it goes. There we go. Well, it's certainly different anyway, but you're all healed up now, so that's all very good. Thanks for stopping by. You did the right thing, but you know, in the future, try to avoid parks. All right. Well, hopefully I won't be seeing you again, although I very much doubt that. But anyway, it's somewhat nice to see you, and yeah, just be very mindful of parks. All right. Well, take care.